Senator Carper's next.
Thank you. I'll mention that to Dick Durbin. So there you go. I have welcome everybody. Nice this important stuff, and we appreciate very much you joining us and sharing your thoughts and your insights. I have a question for Mr. Zach Cooper. If I tell you how many times I've been called Tom Cooper, you'd be amazed. My goal in life is to make sure people start calling you Zach Carper, and now I feel like I finally made it. One of my top priorities as a member of this committee, and Democrats and Republicans, has been lowering the price of prescription drugs. I'm grateful to have had the opportunity to work with my colleagues on both sides of the aisle in provisions in the Inflation Reduction Act to in part lower the cost of prescription drugs. I understand that we still have some more work to do and probably will for some time. One part of expanding access to prescription medications is ensuring patients have the resources to compare prices. Today, hospitals are required to provide certain price transparency disclosures for their patients, but prescription drug prices don't have similar transparency requirements, as I recall. This lack of transparency is especially troubling when it comes to PBMs, pharmacy benefit managers, which are often able to secure cost savings, but do not always shift those savings to pass them on to patients. I think Senator Grassley, in his question, may have raised this already, as along with Senator Menendez. But Dr. Cooper, can you just share with us more on how this committee can support and expand greater transparency when it comes to prescription drug costs, especially relating to the PBMs? I apologize for not being here. We all serve on multiple committees, as you know, and I can't be in 3 places at once, but I try. So take it away.
Thank you, Senator Carper. I feel like I was going to call you Senater Cooper and try to...
Dr. Carper, I've been called worse.
Yeah. There you go. We'll share in it. When I think about the PBM industry, sometimes we really do focus on this question of transparency. And for me, I think in part we're focusing on the transparency issues because there's so little competition in the industry. So I think if it was a very, very competitive industry, we would sort of think that competition would actually lead the end user to get a pretty good deal. And so I think transparency for transparency's sake, I don't know that that's really the missing ingredient in this sector. I think we just really need to think about how to inject competition into it so that it really serves the end users.
All right, thank you. Mr. Thomas, raise your hand, please. All right, that's my first name.
All right.
We're getting a good workout here, huh?
Yes, sir.
I have a question I'm going to ask you to respond to, and also to work with Dr. Cooper to respond to it as well. Delaware is a little state. I like to say it's the 49th largest state. We're just a tiny bit bigger than Rhode Island, and we have 3 counties, and the largest county is called Sussex County. If people go to the beaches, they're all down in Sussex County. More 5-star beaches than any county in America, I think. But we raise a lot of corn, raise a lot of soybeans. But it's still a rural county. And I asked this question with Sussex County in mind. Access to comprehensive healthcare services can be essential, are essential in rural communities, including the ones I've just described in southern Delaware. Smaller hospitals like a hospital called Tidal Health and Bay Health in Delaware experience great benefits from horizontal consolidation. However, research has shown that some mergers across the country have increased costs to federal health plans and to patients. And I oftentimes say, find out what works, do more of that. And here's my question, Dr. Cooper, Mr. Thomas. Can you share some best practices for merged facilities across the country, especially in rural communities that are doing a great job of providing innovative and efficient services without increasing the cost to federal health plan or to patients? Please.
So thank you for the question.
Thank you.
So one of the things that we've seen is through some of the telemedicine, as small community hospitals, we do not have the resources to stand up some of these services. So as we've worked with some of our partners to bring some of those services to our community, we've seen tremendous benefits. When I had the opportunity, we had 5 oncologists decide to leave the other hospital and join our facility. We were not in the cancer business, and so I was pretty worried about having a cancer system that my wife, if she ever received services. So we reached out to the Huntsman Cancer Center in Salt Lake City, Utah, and they were tremendous advocates for us, helping us set up that program, helping us oversee. And so we have the best of the Huntsman Cancer Institute in Grand Junction, Colorado. There's no way we're going to be big enough to do bone marrow transplants and some of the most advanced cancer care, but with our partnership, we can get cancer care local, we can do chemotherapy, we can do radiation therapy, but then we can work with our partners to get them to the Huntsman Cancer Center for those types of services. So I think there are a lot of examples, Senators, of some of those collaborations that work. We don't need to be, I guess, purchased or become part of a system to achieve those gains, but there's a lot of opportunities out there to collaborate and work together, and those are two examples from our community.
Thanks. Dr. Cooper, very briefly, one more best practice that you could share with us.
I think, Senator, I'd echo your point, which is not all mergers are bad. And I think what Mr. Thomas was highlighting, which I agree with, is integrating telehealth into some of these smaller sites can basically mean the sites that can't do everything for everyone have access to a broader infrastructure via sort of this hub and spoke model, where the small place gets the advantages of the big hospital that maybe is in a more urban area.
All right, good. Thanks. Thank you all again. This is an incredibly important subject, and we need your help, and we appreciate it. Thank you.